Experience of implementing the Good Practices Guide, person and family-centered care practices in the school for parents of premature newborns hospitalized in a high-complexity intensive care unit. Implementation experience of the Guide to Good Practices in care, person and family center at the school for parents for premature newborns hospitalized in a high care intensive care unit complexity. Introduction. That's Treasure Nursing Practice Model RNAO. The second part is the development of it, parent school, clinical simulation, integration of the good practice guides, and its conclusion. In the fourth slide, we are going to see the application of the nursing practice model from the Cardiovascular Institute, where nursing contributes to a transformative care practice. The fifth slide explains the organizational level, everything about the practice of the nursing and the directional that it has, articulating the nursing practice model and the guide to best practices in person and family-centered care in the parental school. Better experience, we start with a joint decision to achieve the best outcomes, the excellence in care. All interventions are focused on the neonatal family, the educational part, that is the parent school, in building an stimulation-based environment, and the research. Later, the impact will be measured at the family level and within the neonatal intensive care. Then we have on the sixth slide the best practice, the excellence in careful, the education and the research and the innovation. In the best practice, we see the joint decision-making practices in the NICU, in the excellence, in the experience of careful of the neonatals. We take care of the family and neonatal interventions. In the part of the education, the construction of the parents' school in a simulation environment, and in the part of the research and innovation, the measure of the impact of it. On the sixth slide, we are going to see the RNAO, that is the Professional Association of Registered Nurses, the nursing practicing, and the students in Ontario, Canada, the strong and credible voice that leads the nursing profession to influence and promote healthy public policies and clinical experience. On the eighth slide, we see the Good Practices Guide for the program. The Association of Nurse Registered in Ontario, RNAO, launched the Guides program that it was on November 98, starting with funds with the government of Ontario, Canada. The purpose of this program basically supports all the nurses by providing them with guidelines for best practices for care customer. And the program has been designed in multiple cycles. Each cycle consists of 5 phases: development, dissemination, implementation, evaluation, and sustainability. Basically, we see the best practices spotlight organization, optimizing patient outcomes through evidence-based practices and a strong healthcare workforce engagement. The vision of the program, that is transforming care delivery through knowledge, locally, nationally, and internationally. The World Health Organization and the America's Health Organization as well. According to the WHO, it says that children worldwide is born prematurely, and that the premature birth rate ranges between the 4% and the 16% of children. In the year 2020, the WHO reported that the 68% of premature newborn death can be prevented through breastfeeding, and as well as the appropriate hygiene practices and qualified personnel who provide quality care that will care through the lives and reduce the death births. Basically, we see the epidemiological bulletin in Santander and the HIC Cardiovascular Institute. In the first one, by the 2023 year, the week 47, we had 180 cases of perinatal and neonatal mortality for Santander, and within the main causes perinatal asphyxia and prematurity. For the second part, the Center of Excellence for Respiratory Distress has been awarded for the year 2023. Extremely premature, 6.77%. Very premature, 27.1%. Moderately premature, 23.7%. And the late premature, 42.3%. Essentially, we have three main points. The first one is premature babies and hospitalization. The second one is the challenges for the health team to bring together all efforts to achieve hemodynamic stability and therefore require invasive procedures and interventions. And the last one is the parents with uncertainty, that mainly they don't know what to do and how to act under specific circumstances, and subject to the economic, physical, social, and material factors. On the 14th slide, essentially, we have three more points. The hospital stay of the premature newborn requires a comprehensive transition of care program aimed at parents. The other part is the CCPF, that is defined by the WHO as a wide range of intervention made to reduce the physical and neurological stress of premature newborns within that period. And the last part, but not least, is the Care Center Guide, Person and Family, in the RNAO. That evidence-based approach that combines a perspective that recognizes the place of the person as the center of care, improving the experience of the patient and their families, as well as the satisfaction of the service provided by the health professionals. This slide mainly shows the parent school that aims to provide person and family-centered care, educating and teaching based on needs, achieving the successful development of the training activity. The meaningful learning there is an educational tool that helps gather the knowledge parents have about newborns. With new knowledge integrated into the school, a new construct will emerge. The clinical simulation initially used in medical training has now been adapted for the school to achieve practical learning and apply it to the NICU family and reality. On the 15th slide, essentially we see the School of Parents focus attention on the newborn and family, the effective communication that we need to have, strategies of learning, the significant learning, and the simulation of the clinic. This one consists in these three phases: informing about the activity and consolidation of the previous knowledge, the carrying out of the activity development, and the evaluation that is scheduled in sessions activities. We see the pre-reading, the scenario, and the deep reading of all the simulation. On the 17th slide, you will see the aim of all of this: to reflect on experience of the School of Parents for premature neonates and the implementation of the RNAO Clinical Best Practices Guide related to the content and the strategies provided to parents attending the neonatal intensive care unit. We will see the parents' school. To start this process, the document mainly it is Procedure for Parents' School for Children Hospitalized in the Neonatal Intensive Care Unit that was designed, which is located on a quality page with the code PMA 150124 of the Cardiovascular Institute of the International Hospital in Colombia. There are 4 phases there: care, focus on the hospitalization, newborn, and his or her family, patient safety, breastfeeding, kangaroo mother method, and the child care. Essentially, we have the recommendations for the practice. In the assessment, we have the first recommendation that is establish the therapeutic relationship with the person using the verbal and non-verbal communication strategies to build a relationship of trust and respect. And obviously the level of evidence. We have 3 main central axes for the School of Parents and the activity development in the practice: the care center on the hospitalized newborn, and obviously their parents, patient safety. Obviously on that one, for the practice, we're going to see the tour of the institution, the service, and the most popular places. Also, we have the care focus on the hospitalized newborn and their families in the breastfeeding maternal part. Generate that individual and collective space to listen to their needs, fears. Then we have the care focus on the kangaroo mother method, and that is the getting to know my body and our baby's body. And then we have the part of the child care, that is the culture and individual beliefs. Basically, we have the model of communication that is structured to provide more information to the patient about what is happening, yes, in the situation, in what happened, the evaluation and the recommendations of all of that, where we basically describe the first situation. Then we show everything about the age, sex, the principal diagnosis of it, when it was entered into the hospitalization, the actual treatment, and all the possible and principal results. Then we have the description of the problem detected. And then we have the planification of all the recommendations about the measured data that it was already taken. On the 21st slide, basically we have the recommendations for the practice, the central axis as well, and the activity of the development of the practice. Yes. So we have in the planning, we have the development of the care plan in collaboration with the persons. Yes. It makes that the persons have a sense for everything that is happening and the context of their lives. We have the care center on the hospitalized newborn based on the parent school procedure for premature full term. Then we have the breastfeeding maternal, the empathy with the breastfeeding process. Then we have again the mother method kangaroo that is schedules according to their needs. And then we have the child care, that is the respect for their beliefs, obviously, that determines the guidelines to follow. We mainly see part of our team. The example of the first parent school session in the context of patient safety. How is the implementation of it? We have the roles and the responsibilities in care and communication strategies. We have for the central axis and the activity development, we have the patient safety, that is the infrastructure, the emergencies, their rights, their duties. On the breastfeeding maternal, we have the myths and the realities of the breastfeeding. On the mother method kangaroo, we have the awareness workshop in the kangaroo mother method. In the child care, we have essentially the practical, the learn, I learn, and the detect, but I detect. Essentially, we have an example of the first parent school session in the context of breastfeeding using simulators to teach all the techniques. We have an example of the first parent school session in the context of kangaroo care using simulators to teach all techniques. Essentially, the example of the first parent school session in the context of childcare using simulators to teach home practices as well. We have the recommendations for the practice in the assessment. The recommendation that is the 4.0, obtain the feedback from the person to determine the satisfaction with care and whether the care provided in person and family centered. Over there we have the central axis and the activity development for the patient safety, for the breastfeeding maternal, for the method mother kangaroo, and for the child care. Debriefing, post-test, verification by the LC patient safety, the time spent on mother method kangaroo, and obviously preparing for discharge parents' school graduation. What does it bring new? That is essentially simulated education in hospital environment in situ offers an opportunity to interact with parents and premature newborns to generate environments of trust and learn to reduce fears of the unknown, promote parental participation in the care of the newborns throughout the integration of the GVP, person and family centered care of Registered Nurses Association of Ontario, the RNAO, as a cornerstone of quality in the care of premature newborns. We will see the conclusions, the School of Parents as a strategy to facilitate education in environment of in situ clinical simulation, allows through scientific evidence to empower the parents, achieve transitions of care with favorable clinical outcomes in premature neonates, as well as demonstrate organizational excellence in the person and family centered care. And in our last slide, we will see the nursing team. Thank you so much.